Schwannomas are also known as neurilemmomas, and they are tumours of the nerve sheath. Plexiform schwannomas are rare, they are benign, and they arise slightly more frequently on the trunk than elsewhere in the body. These lesions may be painful. They tend to occur in a younger age group than the ordinary type of schwannoma, and 5% of plexiform schwannomas arise in patients with neurofibromatosis type 2. Plexiform schwannoma is not usually associated with type 1 neurofibromatosis. Plexiform schwannomas are usually 3 centimeters or less across, and they are composed of multiple encapsulated nodules that in 2/3 of the cases arise in the dermis. This is a low power view of a plexiform schwannoma, and you can just see these slightly darker pink nodules in the deep dermis. Here is a higher power view, and here is a high power view of a nodule in this plexiform schwannoma. You can see that the nodule shows all the features of an ordinary schwannoma with palisaded nuclei, and the nodule itself is well demarcated and encapsulated.